Chapter 12, Venereal Diseases. Doctors Bosanquet and Eyre, in their book entitled Serums, Vaccines and Toxins, were constrained to admit, quote, "It cannot be denied that in a certain number of instances the injection of diphtherial antitoxin has been followed by death directly attributable to the action of the serum." Unquote. One of these tragedies, the earliest and perhaps the saddest, befell Dr. Langenhans of Berlin. Because one of his servants developed diphtheria, as a precautionary measure he inoculated his perfectly healthy child of 1 year, 9 months old. In a few moments the unfortunate child was dead. The irony of it is that there was not the slightest evidence to prove that the child would ever have contracted the disease, seeing that diphtheria germs may be found in a number of quite healthy throats, and in such an environment are as harmless as are many other supposed to be deadly germs. But alas, it is not merely injections for diphtheria that have proved fatal, for hundreds of deaths, many of them instantaneous, resulted from the use of salvarsan, otherwise called 606, in the treatment of syphilis. Nevertheless, just as immunization against diphtheria is boosted, salvarsan was boosted as the cure par excellence for venereal disease. Of syphilis we read, "Whether he has been treated or not, the patient is always liable to develop nervous symptoms. These are the most serious of all the complications of syphilis, and the commonest are general paralysis and locomotor ataxia. They usually show themselves about 10 years after infection. In general paralysis there is progressive dementia, usually with some form of exaltation. The speech is hesitating, slurred, and tremulous. The face muscles and tongue show paresis with tremor. Later, the muscular powers become gradually weakened until there is more or less general paralysis." It's a quote by Dr. E.H. Ruddock, M.D. This is a most unpleasant and saddening picture, yet I suggest that the horrible after effects of venereal disease are the result of suppressive treatment. What, after all, is syphilis? It is simply the result of a poison which is absorbed into the body, and hence the rational treatment is to get that poison out of the body. As the medical profession reserves the right to treat venereal diseases, and has its clinics for that purpose, I, as a layman or a naturopath, as I am sometimes called, am prohibited from treating it. All the same, there are men who, having heard of urine therapy through the late Mr. Baxter's pamphlets mentioned in Chapter 11, and through other channels, have set about treating themselves. I will here give the case of a man who contracted venereal disease in France during the last war, 1918. He had, by the way, suffered for some time from psoriasis, which he had suppressed with herbal ointments. This man, still young, knew something about nature cure methods, and had endeavoured to treat his venereal disease by subsisting for a time entirely on cold water in the hope of, quote, "starving it out." At the end of an 11 days fast, however, his symptoms, far from being better, were decidedly worse. It was then that he came across one of the Baxter booklets. The upshot was that he decided to continue the fast, but, be it noted, with the addition of the internal and external use of his own urine. The results were gratifying in the extreme. At the end of 10 days, every sign of the venereal disease had vanished, and the psoriasis had greatly improved. Nevertheless, he decided to continue the urine fast until all traces of the skin complaint had disappeared. This eventuated in 1 more week, and he found himself free of all his troubles. And not only that, but he also found that his sight, hearing, senses of taste and smell had become more acute than they had been for years. Most people are now familiar with the orthodox methods of dealing with venereal disease. Sufferers are invited to attend clinics where they are treated with injections. The treatment may last over a period of either weeks or months. But although members of the poorer classes may attend these clinics, notabilities, particularly in the smaller towns, prefer to be treated by their own doctors, as they feel a certain embarrassment at showing themselves in a place where they may be recognized. In any event, the grave question one asks oneself is, what will be the after effects of these injections? It is one thing to treat the disease, but that is not the same as permanently curing the patient. Wrote to Dr. W. H. White, M.D. of Orthodoxy, medicine ignores the individual wholeness and treats the disease as a separate entity. Thus, there are remedies tabulated for practically any ailment from rheumatism to syphilis, but as the homeopath points out, what the allopath calls rheumatism may come from 20 different causes. Were he to say from 20 different secondary causes, this would more approximate to the truth. Hence, the name of the disease is of really no importance. Regarded from my particular point of view, I would even add, nor how it has been contracted, for the method of cure, as I have shown, is the same. To revert to the case of venereal disease I have cited, if the young man in question had employed urine therapy from the first, instead of trying to treat it with what are termed nature cure methods, I am convinced that it would have been cured far sooner. From what I have been able to gather from others who have tried urine therapy on their own, I have good reason to believe that where venereal disease has taken in its initial stage, or during the present week, cures have been effected anywhere from between 48 to 96 hours. That is, provided it has not been complicated by the usual treatment. But of course, it is illegal for me to treat this age-old affliction. I am in no position to furnish case histories. Still, to exclude from these pages mention of such diseases as the medical profession reserve the right to treat by their own methods would be to leave my task only half fulfilled. Considering that a proportion of all the blind, the deaf, the mentally deficient, and the crippled owe their disabilities to venereal diseases, see Britain's Health, it becomes the duty of anyone, be he doctor or layman, who has found a means of curing it, to make his discovery known, so that doctors can make use of it if they wish. What we have to remember is that measures employed for treating venereal diseases, as most others also have their day, are found perhaps to be unsatisfactory, and then are superseded by other methods. Although it is doubtful whether the clinics will be prepared to try urine therapy, there may be some private doctors who may be willing to give it a trial. Time alone can show. I may add, by the way, that although doctors do not realize the full value of urine, there are those who have pointed out that if only men would micturate immediately after coitus, the risk of contracting venereal disease would be minimized. The late Mr. Baxter, J.P., was right when he published the fact that, among other things, urine possessed strong antiseptic properties. End of chapter.